Hello, I'm Dr. Modena Wilson. I'm the Chief Health and Science Officer at the American Medical Association. As you know, healthcare in the United States is undergoing unprecedented change, increasing pressure to find new structures and solutions for our healthcare system while preserving what's best of the old is having a profound impact on both patients and physicians. Recognizing these challenges, the AMA is leading efforts to shape the physician of the future through three initiatives. First, we're identifying innovative ways to train today's and tomorrow's physicians, the medical students of today. Secondly, we are focusing on strategies and models to improve the work-related satisfaction of our physicians. We also are concentrating on partnership with many others to work on type 2 diabetes and cardiovascular disease.
Hi, I am Karen Kometic. I am the Group Vice President for Improving Health Outcomes at the American Medical Association.
Hello, I'm Michael Tuddy, Vice President of Physician Practice Sustainability with the American Medical Association.
Hello, I'm Susan Skoshalak. I serve as the Group Vice President for Medical Education at the American Medical Association.
Susan, we continue to hear about needed changes in the way physicians are educated and trained. In your opinion, what innovations in medical education can better prepare our future physicians?
It's a priority question that we've chosen to tackle here at the AMA. You know, physicians are well trained in medical knowledge and clinical practice. We've had that kind of training in the United States to be proud of for many years. But with the changes in our healthcare system today and those that we anticipate into the future, we know that physicians need to be trained differently. Some examples of those changes include the fact that most students and residents are still training on rotations in hospitals, and yet more than 90% of patients get their care in the outpatient setting. We also know that physicians tend to be trained in isolation, and today team care is more important than ever. Physicians are well trained in how to order tests and to choose particular drugs for treatment, but they don't really understand what the costs of those are and how they might bring better value to the patient in the healthcare system. The opportunities to make these changes have been discussed for more than a decade, and the research has shown that those recommendations for change have been out there, agreed upon across the nation, and yet have not been able to be implemented. To do that, we established a program with 11 medical schools by awarding grants to allow them to move forward on their exciting and innovative ideas in changing medical education. The 11 schools received $11 million for a 5-year project, and they are forming a consortium to work together to bring new kinds of education into the medical arena that would include moving their patients into the outpatient setting in various new roles that is of value to the healthcare system and also is an authentic role for students to participate in. We know that there are also many other U.S. schools that are trying to improve and innovate in the very directions that we're discussing. Here are some of the questions we thought you could help us with. What innovative changes in medical education training do you think can be implemented to better prepare our future physicians? Another question we'd like to hear from you is, how can patients be directly involved in teaching medical students and physicians in training? And finally, we're interested in what you think, especially as a patient, in the qualities that are most important to you in training physicians of the future. We're really looking forward to your ideas during the jam.
I'm going to turn next to Michael Tuddy. Michael, some of my physician colleagues tell me they're no longer really enjoying the practice of medicine. I know your team's been out across the country talking to physicians in many different kinds of practice.
Thanks, Dr. Wilson. You're exactly right. We've been hearing these comments from many physicians now. And you can see why, too. As the American healthcare industry continues to evolve, physicians in every state and every specialty must comply with new rules, expectations, technologies, and costs that keep them from doing the very thing that they were trained and want to do: care for patients. There are numerous studies highlighting what we've been hearing. One study notes that 30 to 40% of physicians are experiencing symptoms of burnout. Another study notes 9 in 10 physicians would not recommend the profession of healthcare. Workforce satisfaction matters. In almost every other sector, there's a clear correlation between employee satisfaction and the customers they serve. But workforce satisfaction is sometimes overlooked within healthcare, especially for physicians. So what are the issues? Many physicians are dissatisfied with their practice because they spend much of their day performing functions that do not make full use of their professional training. These non-clinical demands consume a significant portion of their workday, reducing the amount of time spent with patients. As a first step, the AMA partnered with Rand Health to study the issue of professional satisfaction. Through a large study that was released last October, we've better understood the factors influencing professional satisfaction and practice sustainability. 2 factors stood out from the study as having an important effect. One is quality of care, and 2 is electronic health records. First, physicians are passionate about providing high-quality care to their patients, and when they're able to do that, perceive high professional satisfaction. When they feel at the end of the day that they were not able to provide high-quality care due to administrative demands, time pressures, or their electronic health record, they are less dissatisfied. One of those biggest distracting efforts is the electronic health record. While physicians are excited about electronic health records, excited about the promise of new technologies, electronic health records today sometimes have user interfaces that take activities that used to take seconds and now take minutes. Multiply that over numerous patients over the course of the day, and physicians are spending more time in front of the computer than they are spending time with their patients. We need to fix these problems. But we keep asking ourselves, and the public, both physicians and patients, what are the things that we can do to better improve the patient care experience? So we're looking for your feedback. What do you think are innovative strategies or solutions that can be implemented to reduce the amount of time physicians spend in non-patient facing work? How do we continue to attract and retain high-performing individuals into the medical profession? Finally, what are some new tools that could help better care for patients?
It takes patients, it takes physicians, but that's not all. And I want to ask Karen to make some comments to advise us about what might be appropriate for clinic community linkages as we seek to bring down the toll of chronic disease. Karen?
In our country today, some 30 million adults know they have high blood pressure or hypertension and actually tell us they are seeing a physician. They have a source of care, and yet their blood pressure is not controlled. That's 30 million Americans. We also know that today, 26 million adults have type 2 diabetes. But in addition, 79 million adults are at risk for developing type 2 diabetes, a state that's known as pre-diabetes. In fact, 1 in 3 of us are at risk for developing diabetes. We know that physicians are critical to the health of their patients, the physician-patient relationship. But we also know there are many other determinants of our health. For example, our genetics, the environment in which we work and play, our behavior. And we also know that medical care itself actually only represents about 10% of our health. These other factors have a great impact. And that's why we're focusing on building linkages between clinical practice, where physicians practice medicine, and resources that are available to patients in the communities in where they live and work and play. In essence, we want to tear down those walls of the clinical practice. For example, there are places in the community where an individual who has high blood pressure or hypertension could go to receive assistance on how to properly take the medication that has been prescribed by their physician. We also know there are places in the community where an individual can go to have their blood pressure taken. An accurate blood pressure reading is so important to the proper diagnosis and treatment of high blood pressure. So there are places where someone can have their blood pressure taken accurately in between visits with their physician, prevent the trajectory and the progression to type 2 diabetes. For example, there are more than 500 organizations today across our country who offer a lifestyle change and exercise program that is supported by the CDC's National Diabetes Prevention Program. In fact, we are partnering with the YMCA of the USA because local Ys across the country in more than 41 states are offering this diabetes prevention program, and more than 19,000 individuals are already participating in the program. We'd like to figure out how we can help physicians refer patients to these types of programs, build these community clinical linkages. What role could IT, information technology, innovation in IT, what role could that play in helping us to make these linkages between the traditional physician practice and these new programs that are available in communities to support patients? Another question would be, what is a game changer today in forging new linkages between clinical care and community resources, all toward preventing chronic disease? And lastly, what would patients want to know and hear from their physicians in terms of the availability of these programs in their local communities?
For more than 165 years, the AMA has concentrated on the art and science of medicine and the betterment of public health. As times change, our commitment to the patient-physician relationship remains strong and central. But as the world changes, physicians may need new skills, new approaches, new structures and ways of working with patients and with working with the public to achieve those outcomes for us all. What do you think the physician of the future will look like? What will he or she do, and how will he or she do it? What will be needed to make all of this possible? Please go to our forum and provide your ideas, comments, and suggestions on your physician of the future. We thank you.